Early Seattle boosters portrayed the city as being built on 7 hills. They claimed that Seattle was the healthiest city in the nation. In reality, Seattle was built on water, on tide flats filled with sawdust from lumber mills, on land wrangled from the abundant rivers, lakes, and swamps. Since its founding as a settler colonial frontier town, Seattle has had regular outbreaks of infectious diseases, and its people have suffered injuries from industries like logging, fishing, and mining. From the beginning, Seattle has had one of our nation's highest rates of homelessness, a boom and bust economy, the extremes of great wealth and abject poverty. It's not just a religious, but also a civic duty to care for those less fortunate. The emerging United States adopted versions of the English Poor Laws, along with the conflicted views on poverty. Poverty as a result of individual sin, poverty as an unfortunate yet necessary societal evil, especially for societies built on capitalism. In the early years of the founding of Seattle, scientific charity became fashionable. The belief that charity work should be made more efficient, empirical, and secular. Public health research established that poor health, poor living and working conditions, both causes and prolongs poverty. Workhouses and poor farms were established. Overseeing the poor became the job of government. In 1854, the Washington Territorial Legislature passed the first Poor Laws. The duty to support a poor person was first the responsibility of the person's family. In their absence, county officials were responsible for the provision of board, nursing, and medical care to any non-resident pauper falling ill while in the county, and for the provision of a proper burial in case of death. King County, where Seattle is located, established a pauper's gravesite on land along the Duwamish River a few miles south of downtown Seattle. The county commissioners auctioned off care of paupers to the lowest bidder. When the number of wards of the county increased, the commissioners opened a poor farm beside the pauper's graveyard. They contracted with the Sisters of Providence to take over the nursing and boarding of the county's poor. 3 sisters arrived in Seattle on May 1, 1877, and opened the King County Poor Farm and Hospital. Their first patient was a 43-year-old laborer, originally from Norway. He was admitted on May 19th and died on July 12th. The first female patient, a 19-year-old domestic servant, along with her 2-month-old infant, were admitted on May 26th and discharged a few weeks later. The sisters record that they encountered anti-Catholic bias from the community, along with a stigma attached to what was considered a poorhouse and not a hospital. After 14 months of caring for patients at the poor farm, the sisters and their patients relocated to Providence Hospital, the sisters' newly built hospital in downtown Seattle. King County commissioners continued to contract with the Sisters of Providence until 1887, when they hired their own nurses and moved the county patients back to a refurbished King County Hospital at the poor farm, expanding further in 1906 to a 225-bed hospital, and finally in 1931 to the new 400-bed Harborview Hospital on First Hill in Seattle. Harborview Medical Center continues to fulfill King County's mission of providing health care to people experiencing financial barriers to care. It is the largest hospital provider of charity care in Washington State and is the only Level 1 trauma and burn center for Washington, Alaska, Montana, and Idaho. It is a center of our area's disaster preparedness and response, disasters including earthquakes and pandemics. During the COVID-19 pandemic, when we were asked to shelter in place and overcrowded homeless shelters were shuttered, the former Harborview Nurses' Home, now called Harborview Hall, across the street from the main hospital, was converted into a 45-bed isolation and recovery center for people with no permanent housing. We may still have conflicted views on poverty and homelessness, but we also recognize that we are our brothers, our sisters, keepers.